Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician with interest in cancer prevention and also public health. Today we are going to look at endometrial cancer, or one of the common cancers that affects women, and it happens in the uterus. So endometrial cancer originates from the inner lining of the uterus, and it is one of the commonest cancers that affect women, and it's a cancer that can be easily diagnosed because of its presentation with the abnormal bleeding from the vagina. Most of the common types of this cancer are called adenocarcinomas. This is the 60th most common cancer in women, and it claims over 420,000, more than 420,000 new cases are diagnosed annually, and claims over 100,000 lives annually. So this is, you can see, life-threatening condition. The risk increases especially with the obesity, and also aging is a risk factor. Mortality or death is high, especially in the low and middle income countries, especially due to late presentation. So this is concerning. So what are the risk factors for getting endometrial cancer or cancer of the uterus? Hormonal factors are involved, especially unopposed use of estrogen, early onset of the menses, and also late menopause. This includes a long period of exposure to the female hormones, especially estrogens, and this increases the risk of getting endometrial cancer. The other risk factor is being overweight and obese, and also lifestyle characterized with inactivity and high intake of fat. So some of the medical conditions like polycystic ovarian syndrome, having diabetes, having hypertension. As you can see, some of these conditions are also conditions that are related to lifestyle, being obese, being inactive. So it is highly encouraged that we check on our weight, we check on our diet. Of course, some medications, especially tamoxifen, which is one of the drugs that is used in the treatment of breast cancer, it increases the risk of getting endometrial cancer. And of course, there is genetics. It has been shown that some people with some genetic condition like Lynch syndrome have higher risk of getting endometrial cancer, and also a family history of ovarian cancer or breast cancer increases one's risk of getting this cancer. So usually, as I've said, it is estrogen dependent, and it accounts exposure to estrogen causes about 80% of the cases. Then there's the other is type 2, which is estrogen dependent. It is more aggressive, and it is associated with some genetic mutations. These are abnormalities in the genes. So what are the clinical symptoms? One is postmenopausal bleeding. Any lady who has had menopause and then bleeding starts after 6 months, then should seek medical attention immediately. Abnormal uterine bleeding, which you may have more heavier menses, or in between the menses bleeding, extension of the period of the menses. Then, of course, ultrasound, especially transvaginal ultrasound, which is used to check and to estimate the thickness of the endometrial lining, which is the inner lining of the uterus. Then, of course, the gold standard to make a diagnosis is doing an endometrial biopsy. This is where suction and curettage is used to take some cells from the endometrium, and if there is abnormalities that are linking towards endometrial cancer, then diagnosis is made. Then, of course, there is staging using a CT scan, MRI, and the PET scans, as we have explained in some of the previous videos. You can look for some of the explanation of this test but they are also indicated. The staging is usually 4 stages. We have stage 1, which is just confined to the uterus. Then you have stage 2, where the cancer extends to the cervix and it is within the uterus. Then we have stage 3, where the cancer has involved the uterus and then it has spread to the surrounding tissues of the uterus. Remember, the uterus is next to the rectum, it's next to the urinary bladder, and then of course to the vertebral column. There are lymph nodes that are happening all these areas, and as we have explained in some of the previous videos explaining lymphomas, we have shown what are lymph nodes. For more information, you can check some of these videos for more information and for more enlightenment. Then there is stage 4, where the cancer now has moved beyond the pelvis to the rest of the body, including the chest, the liver, to the brain. And so this is stage 4 cancer. So treatment is the main treatment modality is surgery, which includes total removal of the uterus and the ovaries, both of them. Then there is also radiation, which is more localized to try to remove the malignant cells from the pelvis. You also have chemotherapy, whereby anti-cancer drugs are used to treat the cancer, including carboplatin and the paclitaxel. These are the chemotherapy used for endometrial cancer. We also have hormonal therapy using some of the progestins for the receptor positive tumors, and of course immunotherapy for some of the anti-cancer drugs. So I encourage you to subscribe to our channel for more informative content, and also share these videos within your circles for more enlightenment and also for awareness and prevention of cancer. As you have seen, there is a global concern about the cancer, and so the more we are aware, the better we are equipped for the prevention. So what are the complications of endometrial cancer? They include local symptoms, which include pelvic pain. Of course, there is abnormal bleeding, which can lead to anemia, and of course the discomfort that occur with it. We have the systemic complications, which are associated with the metastasis, which occurs to the lung, to the liver, to the bones. And then also we have the treatment related, especially like the removal of the uterus and the ovaries. There is the surgical complications associated with it. You can have infection. You can also have radiation associated complications, like affecting the bladder, the bowels, and also the side effects of chemotherapy, which all of us are aware of some of them. So as we have seen, endometrial cancer is significantly a lifestyle type of cancer, and so how to prevent it is basically this healthy lifestyle, which includes maintaining your weight. Please exercise regularly. As I've said before in the previous videos, try to include about 150 minutes of moderate to aggressive exercise per week, and taking a diet that is high in vegetables and fruits. Avoid unopposed estrogen therapy, especially if it is not indicated, and if for any reason you have to undergo this estrogen therapy, then you consult with your healthcare providers. Regular screening for those with the family history of cancers. It is very necessary to have a discussion with your health provider about your risk and also what you can do to prevent yourself from getting the cancer. And of course, adequate treatment for obesity, diabetes, and hypertension. As we have seen, these are some of the risks that are involved in endometrial cancer. Thank you for watching. Please do remember to subscribe, share, and also hit the bell on the screen for more informative content. Thank you.